do. But I'm fortunate that I had the grounding in terms of my parents, that I was supposed to go and do whatever I felt I had to do in terms of social justice. Since I was a little kid, my father would explain politics in Indonesia and what was happening with Sukarno and Suharto, and it's always been something that was part of my life. My husband for 25 years would explain before I went on any trip, this is what's going on in Uganda, this is the politics of Ghana, these are the different tribal unrest things going on in whatever country. So I always got kind of briefing notes and went off and did whatever I was supposed to do. Feeling well supported by the people in my world, and got to raise kids at the same time. So that's pretty, I'm fortunate. I think whatever it is that's going to happen, I mean, they're sort of looking at whether maternal health is still horrible or whether it's moving slightly, or whether, I mean, so there's some academic debate going on about a new study that's just been published in Lancet. I've spent most of my life trying to work to improve maternal health, so it would be nice for me that something was getting better, because the feeling that nothing was getting better just was making me feel kind of exhausted, and exhausted for no good end. So I'd be happy to say, yeah, you know, all those little steps forward in female literacy or the empowerment of women, or those have actually had some gains. But what I find sort of difficult is some of the economic underpinnings of why women remain on the bottom, or why basic maternal health care is not subsidized. Most of the third world women have to pay for the midwife and the emergency obstetric care or the family planning, and then those things conspire to keep women dying at home. So unless we deal with the way we structure healthcare and the way the economy is structured, many third world countries, the gap is widening between the rich and the poor. As soon as that happens, the country looks like they're moving to middle income status, because you look at the per capita income going up, but what's happening is there's an underclass that remains in sort of deep poverty, and that underclass, we know that, you know, the feminization of poverty. Women live in poor, I mean, the single-headed household is usually, you know, women trying to raise children alone, whether it's in our country or in Africa. I mean, that's a reality, and those people do not have the money to get themselves good health care. So those are the women that are living and dying at home with an untrained birth attendant. And trying to get a critical analysis of, you know, political economy of healthcare or society is much more difficult. And there's a lot of politics around it. I mean, you know, the World Bank or the International Monetary Fund does not like to be accused of anything bad when they do structural adjustment loans to countries that are living in poverty, because the dictators that ran those countries got a nice loan and put it in an offshore Swiss bank account, and the money never got really used for what it was supposed to be used for, and then the country has to pay it back, and the poor have to pay for that loan that never got used for them. So those are unfortunate, you know, and highly politicized and hotly contested things that I see from my side. Totally. I mean, and we subsidize healthcare out of taxes. I mean, if you have a progressive society, you fund social goods out of taxation, so that the upper income people subsidize the lower income, and that's what we have in Canada. And it's unfortunate that the model that's been exported to the third world is more an American model, an American pre-Obama healthcare model, where it's a user pay system. So the child who's dying of malaria is having to be asked, you know, the family's being asked for money, and if they don't have the money, the kid dies. The woman who's hemorrhaging dies if you don't have the money. And so the family doesn't even go, because they know that the woman's not going to be looked after. So and then you not only have the problems on the healthcare system, but you have the societal problems where, you know, being in Nepal or having a woman with an obstructed labor where we could offer a vehicle and say we will take her, she needs a cesarean section, and the husband says, let her die, if she dies it's fated, I'll get a new wife and a new dowry. So there's an economic incentive to let women die. And, you know, we have to kind of look at that. If there's an economic incentive for a family to sell their 12-year-old daughter into marriage to pay off a family debt, and that young girl gets pregnant at 13 and ends up with an obstructed labor, that we have to recognize the political realities, the economic realities of poverty. And the idea that we can just fix everything with medicine, or we can fix everything the way we've tried to tackle the big diseases of tuberculosis and AIDS and malaria, dump a bunch of money in and do things. Well, maternal health is a lot more complex because it's rooted in much more so in the culture of the community, which varies from, you know, whether you're a Muslim country or Buddhist or Hindu or Christian. I mean, there's various ways that women are limited in what they're able to do. But somehow, and I still don't understand this. I mean, I don't understand this having been, you know, women raised in a relatively affluent country. Somehow there's an engendered reality where women sacrifice for our children. We sacrifice for our families. If you look at any family, usually it's the daughter who looks after the elders. It's the women who look after the children for the most part. That's somehow engendered, and you know, however we're raised, that says that's what our duty is, and I think that's not culturally specific. Women I have met all over the world, and not just different cultures and different religions, but different socio-economic strata as well. You know, women put themselves last, and it's very hard for women to look after themselves. And when I look at, because I was a family doctor in Northern Ontario, I look at who's looking after the people in the family with Alzheimer's, who's looking after the people in the family with cancer, just as in sub-Saharan Africa, who's looking after the people living with HIV and AIDS. It's women, and women who usually have less of an income, even if they're doing similar jobs to their male counterparts. Somehow women end up less economically strong and with more of the caretaking responsibilities. And we have a value system that makes us feel good about that. So we say, yeah, I'm being a good mom, I'm being a good daughter, I'm being a good sister, I'm being a good community member, I'm doing all this volunteer work. I know many, many bright women in my community who do volunteer work, and they've got master's degrees, and they're raising their kids, and they're wonderful, and that's great. So whether we come into our society and say we are different, women are different, and that those values are both our strength and our weakness.
And that it's a matriarch that's doing it, this patriarchal kind of value.
It's the woman in Sudan who takes her daughter to Somalia and says she must be clean for her husband. And that's why she has to be circumcised. Even if her more educated husband says, I really don't think that this is a good idea, this is actually going to cause health risks for her daughter, but the woman and her mother and her sister take that young girl off and have her circumcised. So what is it about us that perpetuates that oppression? And that's something that I think we have to deal with as women. We're part of that. And how do we raise our daughters? How do we raise our sons? Do we raise our sons that they also share in the caretaking? Or do we do all the caretaking of them and teach our daughters that they should be looking after them? I mean, we're part of that. You know, the hand that rocks the cradle rules the world. Well, you know, are we happy with where we are? And to take responsibility for that. So I mean, it's not really a situation of saying that, you know, men are to blame here. It's a whole set of social constructs that we have to take responsibility for, and if we want to change it, you start with yourself.